I'd now like to introduce the Honourable Gillian Skinner, the Minister for Health, who's going to talk about partnering with the real world. Gillian.
Thank you very much indeed, Andrew. May I also begin by acknowledging the traditional custodians of land upon which we meet, and to thank Uncle Ray for his warm welcome as always, to my good friend and colleague Prue Goward, to Mary O'Kane, Elizabeth Coff, Kerry Chant, and I particularly welcome Peter Wills. It was Peter who really set us on the right path 5 years ago with his review, which then led to our strategic plan, and to everybody in the room. Look, over the last 2 weeks, I've attended functions which confirmed for me the enormous gains that we've made in health and medical research over the past 5 years. At an illustrious gathering of Cochlear alumni and friends on October 25th, our Medical Devices Fund, for example, was the bright star on their horizon. And I throw into the mix for your discussions later on some of the things that those attending there raised as concerns, and mostly they related to things to do with the Commonwealth Government, a need to reform the TGA, the need to invest more in science, particularly through CSIRO, etc., etc. But those are things that they highlighted. Then at a Garvin dinner for supporters and friends on the 27th of last month, again, and the next morning at our Health Innovation seminar on the 28th, Marcel Dinger, Chief Executive of the Kinghorn Centre for Clinical Genomics, spoke of the potential tripling of diagnosis rates for Australians living with rare and genetic conditions with the establishment of Genome 1, Australia's first clinical whole genome sequencing service, a partnership between the Garvin and Pathology New South Wales. His presentation was followed by Phil Robinson of the Children's Medical Research Institute by describing the newly formed initiative ProCan, which will enable the analysis of samples of cancer from all over the world to measure levels of thousands of proteins. Thanks to some speedy work by our own Office of Health and Medical Research, US Vice President Joe Biden signed an MOU with ProCan to be part of his Cancer Moonshot initiative, and I'll talk about that a bit more in a minute. On Wednesday last week, I met with Catherine Greiner as she takes up her role as chair of the newly formed Pediatrio, the translational research partnership that will bring together the three major paediatric research institutes in New South Wales. And last Friday, I attended the Sydney Heart Research Institute's Awards, where 12 scientific groups are working across a range of areas with the aim of preventing death and suffering from cardiovascular disease. And the HRI, like our other research institutes, is partnering with others globally and with increasingly looking toward partnering with others in this state and country. And on Saturday, to top it all off, at the 30th anniversary of the Kirby Institute for Infection and Immunity in Society, the amazing array of world-leading advances in HIV and other infectious diseases was celebrated. In all these events, it was clear that there's a buzz in the New South Wales research world. There's greater collaboration, not only among institutes, but with clinicians in our hospitals and in industry. We're not only retaining our early career researchers, we are attracting others from interstate and internationally, and they are working in partnership through their hubs and our relationships with universities to deliver better healthcare. But of course, there are many more exciting ventures, collaborations, breakthroughs in scientific knowledge and treatment and development of devices and techniques unheard of as yet. And importantly, advances in new models of care that not only improve patient care but deliver value care that is sustainable. I believe that this exchange will help to cement our state's reputation as a global destination for health and medical research. And I congratulate you, Minister Goward, on holding this gathering of very illustrious people to take us forward. In talking about our global collaborations, New South Wales has already established an impressive track record of partnering with international organisations in the health and medical research field. Strengthening our research workforce and increasing translation are key commitments under the New South Wales Health and Medical Research Strategic Plan, and I'll mention just a few. Our successful Medical Devices Fund led to the development of the Medical Devices Commercialisation Training Program, which has been successful in training the next generation of innovators and entrepreneurs in business and commercial development skills. And that in turn led to involvement in the New South Wales QB3 Rosenman Institute Fellowship Program, where we have provided nearly $300,000 in support to build medical device commercialisation expertise for New South Wales-based medical device researchers. That followed my visit with my Chief of Staff and the former Secretary to California a few years ago, and an engagement with them. We're working with QB3 California's Institute for Quantitative Biosciences to develop the 2-year postdoctoral program. The fellowship program brings together a network of innovative clinicians with medical device professionals to maximise opportunities to develop ideas from concept to commercialisation. And I suggested to the 2 initial winners of this fellowship, only thing I required of them, that they come back to Australia to share their ideas and, importantly, to bring all of those venture capitalists from California back to see the marvellous opportunities that exist here. I want to talk about the Garvin Wiseman Centre for Cellular Genomics. So in addition to the New South Wales Government contributing $5 million toward the new Garvin Wiseman Centre for Cellular Genomics, we're leveraging the government investment in genomics through the $24 million Sydney Genomics Collaborative. The centre will combine the expertise of 2 innovative and world-leading research bodies, Australia's Garvin Institute of Medical Research and one of Israel's leading research institutions, the Wiseman Institute of Science. The partnership will bring the Wiseman Institute's experience in science education to New South Wales, including targeted programs that will help science teachers teach genomics to high school students. Wish I was back at high school and learning that kind of thing. Then the US Cancer Moonshot program that I mentioned briefly. It's another example of our innovative international partnerships where we signed the MOU with the US Cancer Moonshot program. The MOU establishes an ongoing collaborative relationship between the Moonshot program and the State of New South Wales to actively facilitate advances in cancer research and cancer control. New South Wales is uniquely placed to contribute to the Cancer Moonshot program for accelerating cancer research. The US National Cancer Institute has identified integrated cancer proteomics and genomics, known together as proteogenomics, I learn all these things as I go along, as a key component of this effort. So in July this year, we, the government, committed just over $6 million for the Cancer Proteogenomics Collaborative as part of the Cancer Moonshot program. And can I say, in congratulating the Office of Health and Medical Research, this was all done in 2 weeks. Just shows that we can move when we really need to get those agreements and understandings going on. And I just want to conclude by talking about the healthcare trade delegation that I led to China in April this year. The 27-strong delegation resulted, for example, just to take one example, in USCOM Limited, a New South Wales-based medical device developer, securing a $65 million contract with a major state-owned Chinese partner, CIIC Shanghai Science and Technology. There are many more things that I could talk about, but time is limited. All I really want to leave with you is this thought. We have a great legacy of international partnering in health and medical research upon which to build. Our challenge is to ensure that we place New South Wales health and medical research at the forefront of international endeavours to capitalise on that medical research capacity. I thank you and wish you a fantastic day. Thank you.